First, again, I'd like to ask you permission to use this testimonial for educational purpose and on internet.
Yes.
Now, let's go all the way back. You had the sacroiliac joint that was diagnosed. When did we diagnose your sacroiliac joint?
Probably January of last year.
January last year.
January of this year. I apologize.
And we diagnosed it with multiple injection there. What was the result of those injections?
I got a significant reduction in pain, especially in my back and especially in my leg.
Especially in the leg. Tell me about your symptoms before the surgery.
I was having significant pain in my leg. I had a very hard time walking. I had a good bit of numbness down the side of my leg, back down the back of my leg, in the foot, just very limited mobility.
And then we did the surgery. When was it? How many months ago was the surgery?
About 3 or 4.
3 or 4 months ago, so not very long time ago. But and that we did it in the university, and but you didn't stay in the hospital, right?
No, I didn't have to stay the night. I was ready to go home.
But you were thinking you may not be able to, but you were able to go home.
Correct.
This is practically the surgery is done with a 1-inch incision, and this is actually what we did. I'm going to turn around and show exactly what we did. We put 2 screws in the sacroiliac joint. Here, this is the down views as well, and they're perfect. Now, but the pain came back. Tell me, what happened?
Some of the pain did come back.
Tell me about it.
I was using the walker, and I had quit using the walker and was going about, and I bent over to pick up a pen that I had dropped.
Yeah.
And part of the pain came back.
What part of the pain come back?
And the pain on the outer part of my leg.
So that is practically the same pain that was there before, and now after the surgery did go away, but then we did that activity, the pain returned.
It did not return near as bad as it did.
Not as bad as it returned.
But it did return some.
So, and we talked about that we looked at the pictures, screws are fine. You didn't do any damage, but that is kind of your body giving you your limitation, what it doesn't want you to do. And most of the time, it's just a setback, and that pain wouldn't go away right away. Usually it's a setback, and it will take sometimes weeks, sometimes even months for that to go away. But overall, about 90%, 95% of the time doesn't have any consequences, meaning it just obviously it's bothersome because it's more pain for a longer period of time. Physical therapy can help. Obviously, not doing those activities that causing the pain is very important. Now, and generally people have 2 sacroiliac joints. How is the other side doing in your case?
My other side is not very good.
So, but that makes sense that we didn't fix the other side.
Right.
And generally we should wait until the first side is properly fixed and you can use it with little limitation before we address the other side. Because if you start fixing both sides, then
pain on both sides.
You're going to have pain both sides. So, any question? And thank you for the interview. Any question? Any? Comment?
No, I just say thank you so much for actually doing the surgery. You're one of the only people that would ever take a look at the sacroiliac joint or even look at doing surgery because of my weight.
Yeah, well, we have shown that we can do that surgery safely, even in higher BMI. And in a way, many of my colleagues says, go lose weight and come back. People don't do that. It's hard to lose weight if you cannot even walk. So, but overall, I'm very happy. Obviously, we have a small little setback, but again, I'm not concerned. You have a good common sense. You will do the right things, and this will go away. Okay? Thank you. I appreciate that.